Now to the latest on the rapidly spreading Ebola outbreak. Global health officials say it's on track to be one of the deadliest on record. Cases are climbing at its epicenter in the Congo and Uganda. The virus has caused more than 200 suspected deaths and more than 1,000 suspected cases of infection. As the numbers grow, so does concern that the epidemic is spreading beyond those countries' borders. Today at the White House, Secretary of State Marco Rubio vowed to keep Ebola cases out of the U.S.
The number one priority of our foreign policy is to protect the American people. We cannot and will not allow any cases of Ebola to enter the United States. And so the State Department and other agencies represented here, the Centers for Disease Control, HHS, others are working very, very hard to contain this crisis to the countries where it's currently located, particularly the Democratic Republic of the Congo.
The Trump administration says any Americans exposed to Ebola while abroad will now be sent to a quarantine facility in Kenya instead of flying back to the United States. Earlier this month, an American doctor infected with the virus was sent to Germany for treatment instead of coming home. Federal officials have also expanded Ebola screening locations for travelers arriving in the U.S. who have recently been to viral hotspots. They can now enter through the George Bush Intercontinental Airport in Houston, Washington Dulles International Airport, and Hartsfield-Jackson Atlanta International Airport. The CDC is also reportedly asking for volunteers among its employees to help screen passengers at those three airports. My next guest knows firsthand the risks and ravages of the Ebola virus. Dr. Neil Vora is a former epidemic intelligence officer with the CDC. He was sent to the Congo for the world's first Ebola epidemic in 2014. He joins me now. Doctor, welcome back to the show. So you write in Time magazine that Ebola is a nightmare disease. There's a roughly 50-50 shot at survival, and the unlucky half will die in agony, bleeding profusely from as their organs fail. Terrifying to read that. How bad is this epidemic going to get?
This is an awful outbreak right now. It's already the third largest Ebola outbreak ever, and it's just been 1.5 weeks since it was first reported. We really need to work on containing it, but the circumstances right now make it really difficult to get this outbreak under control. So it is a terrible situation.
The Secretary of State says the U.S. cannot allow Ebola into the country. We just heard Americans who've been exposed are going to be going to Kenya rather than flying home. The Congolese soccer team must stay in hotels in Mexico even while they come to play in the World Cup in the U.S. and then fly back to Mexico at night. And as you know, the U.S. didn't allow an American doctor with Ebola to come here for treatment, according to several reports. Will any of this work to keep the virus out of the U.S.?
Well, first of all, I agree with Secretary Rubio that we want to keep Ebola out of the United States, but I strongly disagree with what's been proposed by the administration. Essentially, what's happening is that we are closing the U.S. border to Americans who are working abroad to get this outbreak under control. In prior outbreaks, American volunteers and other workers have been critical in getting the outbreaks under control, and we're basically deterring them from volunteering, from working abroad, because they're going to be scared that if they get sick, if they get exposed, they're not going to be able to get back into the country.
Today, Uganda closed its border with the Congo. It had already suspended all flights between the two countries. This goes against guidance from the WHO, which worries that people will just try and sneak across the border instead, which is more than 500 miles long. I mean, they don't have police on every inch of that border.
Absolutely. Closing borders is not really a well-proven technique for controlling outbreaks of human diseases. What we really should be focusing on if we're talking about closing borders is the importation of wild animals into the United States. We are one of the biggest importer of wild animals, and that actually can lead to a lot of outbreaks like this. But for this particular Ebola outbreak, we want to be encouraging Americans to support the outbreak response at the source so that we can keep Ebola contained where it's currently spreading and not get into the United States.
Well, we are getting reports that there are cases that have now spread. Obviously, we have an American doctor being treated in Germany, another American doctor being observed in Czechoslovakia. Italy now reports that 2 people are in isolation at a special hospital in Milan with possible Ebola infection. A man and a woman who were both workers and had just returned from Uganda a few days ago.
Yeah, this is a disease of compassion. People who take care of people with Ebola are going to get exposed, whether they are doctors or nurses or even family members. This outbreak is going to get worse before it gets better. We don't have a vaccine for it, so we have to be using the public health measures that we know work, like contact tracing and safe burials and community engagement. And that's why we need to, as the United States, be supporting healthcare workers from the United States going abroad, trying to contain this outbreak at its source, but allowing them to return back to the country even if they get exposed.
You talk about safe burials. There have now been 3 attacks on doctors and aid groups in the Congo just in the last week. In one case, actually, I think in more than one case, they set fire to some of the facilities that doctors and aid workers are using to treat people. People are upset that they can't bury their dead relatives, their dead family members. One aid expert said, "We're not just fighting a deadly virus, we're fighting fear and deep-seated suspicion."
Yeah, this happens frequently during Ebola outbreaks. It's a terrifying disease, and there's a lot of mistrust already. There's a lot of violence in this area. There's a lot of displaced individuals. And so it's very hard to build the trust with these communities when you have outsiders coming in and out. That's why community engagement has to be a core part of the response. Without trust, it's going to be very, very difficult, probably impossible, to get the outbreak under control.
Yeah, some aid workers say some of the locals in the Congo and Uganda don't even believe Ebola is a thing, that there is a virus. They believe something else is killing their loved ones. So that's what we're up against here as we try to contain this. Super quick, have they found and identified patient 0 yet?
That's really hard work to identify patient 0 right now. It's almost like the fog of war, a lot of chaos, and the focus really is on containing the outbreak as it spreads. But
all right. Dr. Neil Vora, firsthand experience dealing with this in that area. Really appreciate you coming on. Thank you so much. Scary stuff.
Thank you for having me.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.